5, 4, 3, 2, 1.
So we are returning from closed session with nothing to report. And at 6:01, I will invite you to join me in the Pledge of Allegiance. Please stand. Ready, begin. I pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, justice for all.
Thank you. And at this time, I will call for community comments. Are there any?
Yeah, there are.
Is that yes?
Yes. There's 2.
I'm circling.
Okay.
Yes, please, because I don't know how long this will take.
Okay, I'll go ahead and read the community comments. I just want to make sure that we're coming over the air clear for our people out there, Mr. Chacon. Okay. All right. The first community comment that we have is from Anonymous, and their topic is reopening schools. And they say, once again, numbers in our county went up this week instead of down. However, there is no mention of mortality rates changing at all. In fact, with new therapeutics working wonders in hospitals all over the country, I can't help but wonder about the validity of said numbers, especially when determining the reopening of schools. As a concerned member of the Snowline community, I am witnessing kids and teachers alike struggling with anger, depression, and fear, all of which are made worse on a daily and weekly basis. These feelings can and will lead to far more devastating results than a handful of people contracting this virus, which according to the CDC has a survival rate of over 99% for all age groups. I ask that Snowline reconsider its stance on not reopening elementary schools using the cohorts model and its stance on not applying for the elementary school waiver because they want to wait to open all schools. It seems to me that opening elementary schools for both general ed and special ed cohorts or under the waiver would give the district and the sites a chance to test the systems and protocols necessary to keep kids and teachers as safe as humanly possible, keeping in mind that we can never fully protect anyone from ever getting sick ever again. Waiting to reopen all schools with the current testing and monitoring system and with the numbers continuing to trend upwards just keeps pushing a start date for all schools back further and further each week. This leads to more anger, depression, and fear, which will continue to create problems in both children and adults. Suicide, isolation, addictionism, and obesity are just the tip of the iceberg on the things we will be battling to recover from if we continue on this disastrous path. Also, waiting to reopen all schools at the same time seems like asking for trouble in terms of kids and adults getting sick. Why not go slow to go fast and start with bringing back struggling students in grades K through 5 and putting them with teachers willing to be in the classroom with kids? It is being done successfully in Hesperia USD, and I'm confident it can be done here in Snowline as well. Thank you for your continued support and leadership during these challenging times. The next community comment comes from Ashley Alvarado. She has a community comment, and it states this: I would like to ask you, our incredible school board, air hugs and high fives, to encourage our community to complete the Phelan Pinyon Hills Community Service District Park Expansion Survey. As of the end of September, less than 300 responses have been collected. The current plan does not include an aquatic center, but this current survey asks a question about one. I would say most people in our community would agree that an aquatic center could be a great opportunity for our schools to have a way to offer CIF water sports too. An aquatic center is a pie in the sky dream of mine, and I would love our community to share their voice too. It matters. Thank you for the opportunity to share. And those are all the community comments.
Thank you for the comments, and thank you, Ms. Tapp, for reading those for us. And that then takes us to the consent motions, and I would like to entertain a motion at this time.
I'll make a motion to accept the consent agenda items.
Thank you, Member Hernandez. And a second?
I'll second.
Thank you, Member Coloma. Are there any items to be pulled? Any discussion? None? Okay. And so I will call for a roll call vote. Member Hernandez?
Aye.
Member Nelson?
Aye.
Member Colom?
Aye.
And Christina Behringer votes aye. We have then just approved the minutes of the regular meeting by teleconference of September 29th, 2020 of Snowline Joint Unified School District Board of Trustees. The personnel motions, the MOU for field work between Snowline and Point Loma Nazarene University. We've approved and ratified the student-teacher teaching affiliation agreement between Snowline and Grand Canyon University. The agreement renewal between Snowline and Inland Personnel Council for special services. The agreement renewal between Snowline and Fagan Friedman and Fullfrost LLP for professional services, and the district financial transactions. And so that takes us then to item H1. Dr. Holman.
Thanks so very much, President Behringer. And I want to first of all thank everyone for being here and making all this happen. These are not easy events, and so I just absolutely appreciate that. So on each one, what we're talking about is it's an information item first and foremost. So I want to make certain everyone knows this will be brought back at our next meeting for approval. But before we get to that point, it's the SIPSAs, that stands for the the single plan for student achievement, the school plans for the 3 programs that make up our non-traditional schools. Now, the principal of NTS, Chad Brooks, he's here, and certainly please know, again, this is information, but if there are any questions, we can certainly ask of him. The first question that might come up is, where are the other SIPSAs? The SIPSAs for NTS are being brought here because one of the schools, Eagle Summit Community Day School, is receiving CSI, that's comprehensive support and for improvement of schools funds. And the timeline is different for these school plans that throughout the state that receive those CSI funds. And so as a result, credit to Principal Brooks and his entire staff that amount to all the NTS staff. They've gone through the entire process with their stakeholders for all their school plans and have brought them forth here today for information. And again, any questions you might have initially, and then we'll bring them back for approval at the next meeting, President Behringer. So I'll turn it back over to you to facilitate any questions or comments. And again, please know that, Chad Brooks is here at the ready too, if you feel like you need to call on him too.
Oh, okay. Are there any questions of Principal Brooks by the board? None? Okay, well, I have a few. Mr. Brooks, are you there?
Yes, ma'am, I am.
Awesome. Thank you very much. So There was a common thread I noticed in reading the SIPSs for Chaparral and for Eagle. And that is a statement that was made in each of them, each of those reports, that indicate that students are remaining at the comprehensive high school for too long and are experiencing critical achievement gaps that are detrimental when it comes to reaching academic proficiency. So I'm wondering, I know that you have likely spoken with Mr. Miller concerning this and your staff. How is that being addressed? What are we doing, or what will we be doing moving forward?
Good question. One of the things that we started actually at the end of 2018-19 was a transition team. So Mr. Miller facilitated that transition process with Chaparral, Eagle Summit, and Serrano. And what we've done is taken our counselors and Mr. Jones and myself and his assistant principal. And we created this team in which we try to reach the students that might be good candidates for going down to non-traditional schools at an earlier point in their academic career. So instead of waiting till their junior year or maybe even at the beginning of their senior year, we're really trying to catch those kids at the end of their sophomore year. And we're looking at kids that are 30 credits or more behind. So basically, students that don't have the possibility of making up those credits in summer school, they don't have enough summers left to make up those credits. We're really talking to those students and trying to just giving them as much guidance and as much information to make the decision to come to non-traditional schools at an earlier point. There's a lot of reasons that kids want to stay in the traditional schools. I totally understand that. That's where their friends are. They've been there for many years. But ultimately, we try to give them the guidance and some understanding that they're going to receive a much better education if they make that transition to non-traditional schools, where we can really help them choose another path, to make sure that they're getting all their academic requirements done for graduation, but also show them some of the things that we've been working on in non-traditional schools. If they're not going to go to junior college right away, or if they're not going to go to a 4-year right away, but also expose them to the work skills, the soft skills that we're trying to get kids ready for the career, the job skills that they're going to need out there in the career world. So that's starting about a year and a half ago, 2 years ago.
Okay. Excellent. Member Colomb, did you have a comment?
I just saying that's a great idea. I love that idea.
That is awesome. I'm glad to hear that. Thank you for that information. I know that you have a real tough job. I mean, you've got a lot of balls that you're juggling at this time. But there were definite market improvements in the students, and so I'd like to commend you and your team on that. That's awesome. And I wanted to speak to supporting the upgrading of technology over there and getting more smart boards and helping the teachers to engage the students in that way. I had a question a couple of times. It's noted about adding instructional aids, but there's no budgetary attachment to that. Are you talking about just shifting people around then and not bringing in any new resources?
Yes, ma'am. And also this year last year Chaparral received the CSI grant, and we used some of that money to work with our social worker. This year, we're also looking at using that money to help with our social worker, but also we're using it to add a instructional associate. Well, to be able to move that instructional associate over, so we're using some of that grant money to fund that position over at Eagle Summit as well. Although she's not brand new, it's a new position at Eagle Summit. Mm-hmm. So it's within NTS, but we're also using some CSI money to cover that.
And in the Chaparral report, there's mention of MTSS and a symposium, but there again, there's no dollar amount or funding for that. Is there, I would expect, a virtual symposium taking place?
Correct. And so I believe they used to call it the Three Keys conference, but now it's the MTSS conference through our PBIS. So we will have some of our staffs, especially our PBIS coordinators, attend that conference. I don't have the date yet. I don't believe they've come out, but as soon as they do, we will assign those coordinators to that position.
And I appreciate that. I just don't understand why there's no budgeted amount within the SIPSA.
Yeah, I'm sorry. And usually the district funds that for us, and I didn't have a dollar amount to put in there, so it's just an oversight on my part too. I didn't check with Mr. Miller's office of what the actual cost was.
Okay, well, I think that your team is doing a great job. You're doing fantastic with NTSF, and dealing with WASC accreditation is just another feather in your cap right there. Excellent work. So thank you very much for all the effort that went into those. So I see that it is just an informational item. So if there are no other questions or comments, we will move on.
I have one quick question.
Yes.
What's enrollment look like in non-traditional schools, since I would assume that we don't have a lot of kids matriculating from Toronto over there during these COVID times?
We do have quite a few kids coming over, but Mr. Zimmerman, can you help me out there? I don't have the exact numbers right in front of me, and I don't want to just spread out anything.
Yes, I can. Let me grab those numbers real quick, and we've got them.
Well, in the meantime, I did come up with a real quick question about General Atomics. Are they participating in presenting virtually with SHAP?
Yeah, so they've kind of switched their platforms, and they're trying to have a much bigger audience. So they've teamed up with the MDEF team, and they're presenting. They have different presenters. So General Atomics is one of the presenters, but our mechatronics math class and Mr. Berenstein are working to make sure that our students are attending I think there's a 10 session workshop, but it is presented by more than General Atomics this time. I believe Mitsubishi Cement Plant, Walmart, they're trying to help out General Atomics and spread the wealth, but it is all related around mechatronics and soft skills.
Oh, very good. Yes, I'm familiar with the work that MDEF is doing. They're awesome.
Yeah, and President Bench, if I can just jump in real quickly, take advantage of that. I mean, credit to Principal Brooks. He participates in all of those meetings. He's one of the very rare ones throughout the high desert where he's in there on a regular basis. And I want to thank him for that, because the beneficiaries are our students in Snowline. So he said that very, very well. That's really the model that we're endeavoring to develop. He communicated it, I think, spot on. And so thanks for doing your great work in that regard, Principal Brooks, because again, it's our students who are benefiting. And so we're just so very thankful there. And actually in Serrano High School, students have been benefiting from those efforts there too. So thanks for letting me say that.
Most definitely. Thank you. And Mr. Zimmerman, did you have those numbers?
Yes. So currently, Snowline Academy has 303 students more than it had at this time last year. And Chaparral has 14 more students than it did at this time last year. Chaparral's enrollment always grows quite a bit during the second semester, but even at this point during the first semester, they're a little larger.
So is the non-traditional student adapting less well or better to remote learning? Is that for credit deficient students?
You know, Steve, I think a lot of the students that are coming to Chaparral right now are coming based upon what happened last semester. You know, some of those students, you know, that didn't adapt very well, let's say that, didn't adapt very well last semester, you know, they're now coming to the realization that Chaparral would be a better fit. I think the 303 students that are coming to Snowline Academy are coming for a variety of reasons. And ultimately, I think the program that Snowline Academy, which allows a lot of flexibility, is the reason that those students are coming, plus, you know, obviously the COVID-19.
Okay, thank you.
Any other comments? Okay, well, thank you very much, Mr. Brooks. Good job. And nothing takes us to item I1. Dr. Holman.
Yeah, thank you so very much for that, President Behringer. And I guess I would just say, and my apologies, just going backward, is it okay? I know we had asked Principal Brooks to be part of here. Is it okay if we excuse him?
Oh, yes,
as we move
please.
forward? Yeah, and he's welcome to stay. I should say that. I'm not kicking him out here on purpose. other than to say that if you would like to, is that all right?
Yes.
Okay, thanks
Feel
so very
free.
much. Yeah, my apologies for being slow on that one, but thank you there, Principal Brooks, for your efforts. Great.
All right, I'll take my leave. Thank you very much, everybody.
Yeah, the entire staff just doing super work. So thanks so much. So now getting to I-1, this is it's up for approval and also during the second reading for the implementation of board policies, two of them, 0470 and 6157, both tied to the experiences that are facilitated by COVID-19. These come to us via the process that we've been using for many years. We subscribe to California School Boards Association and use their lawyers to vet the board policies that come forward to us. We also work with our leadership team, not just the senior cabinet level, but also put those in front of our sites. And so they've come back to you here today for any other questions you may have and for implementation based upon the desired direction of the board. So thanks, everybody.
Thank you. I'd just like to thank you very much for vetting these policies, and they're very comprehensive. And are there any questions or comments from the board? None? Okay. Well, this is the second reading, so we can go ahead and approve. So I will entertain a motion to approve these board policies.
I'll make the motion to accept the board policies as they've been presented.
Thank you, Member Hernandez. And a second?
I move to set, this is Dave Nielsen, I move to second the motion.
Thank you, Member Nielsen. Is there any discussion? There being none, we will have a roll call vote. Member Hernandez?
Aye.
Member Nielsen?
Aye.
Member Cologne?
Aye.
And I for Christina Behringer. The motion passes. That then takes us to informational item I2. Dr. Coleman.
Yeah, thank you, President Behringer, and really with thanks to all the board members for allowing us to do what we're going to do here as a team, is present to you the updates that come from being again in this COVID-19 environment that specifically have influence on the learning design in the Snowline Joint Unified School District. It seems like every meeting since the inception of the pandemic here, we've had community comments around what is going to happen, right, specific to the learning process. Even today we had that. And so what we're endeavoring to do is to pick up where we've left off. It is only 2 weeks, but in those 2 weeks' time, it seems like each gathering here, we have information that we want to share with you to ensure that you as a board can provide the direction as needed, that we provide the updates to our community, and really move forward for all of our learning community, the best interest of each and every individual, most importantly our students. And so Dennis Zimmerman is going to do me the favor of putting up on the screen. He's going to share the presentation. It's a familiar design. I want to remind the board and everyone who's really connected to tonight's meeting. Please know that our Director of Marketing Public Relations as well as Risk Management, James Fields, he will post this presentation and it'll be posted up for the next 2 weeks until we do the next presentation. So anyone who isn't able to access tonight, and even if you have, you can always have access to this presentation. So as we get ready, what I can share with you here is the outcomes are really the same. What we want to do is provide all of you as a board with a shared understanding around the updates that exist for the at-home learning design, as well as the in-person learning design. And there are a variety of in-person learning designs that we're going to be talking about, as we always do. And we'll also want to get commitment from all of you relative to the next steps and future actions that we're going to share with you as recommendations. So with that, the agenda here, I can just share with you. Here's what we, so if you're wondering before we get to the end what we're going to be hitting on, I think I count, 9 areas that I think we're going to be hitting here as rapidly and efficiently as possible, but also as thoroughly as is needed. We're going to talk about the guidance that we're following. I want to secondarily talk about the current learning designs that we have in place, that you know about, that we've kept you abreast of each and every time we get together. I want to talk about the monitoring system, the changes in that regard. Also, what do the data show right now in COVID-19? And then on slide 3 is where we are, Dennis, as you keep score there at home, so to speak. Also talk about cohorts, youth sports, a hybrid design, elementary school waiver, and then next steps across the system. And so with that, thanks, Dennis. We'll go on to slide number 4. I want to give you that reminder here that just very proud of the group that I get to work with, the senior council on a regular basis, but the staff members across the system. And what we feel like we've heard from all of you is that we're committed to following the public health guidance. 3 levels, right? Federal, state, and local. The CDC, right? As you see, the Centers for Disease Control and Prevention. The California Department of Public Health is that next acronym, and then the San Bernardino County Department of Public Health. We use those 3 entities, and they're all tied and interwoven together, right? Just as you might know that the California Department of Public Health is influenced by the CDC. Our local Department of Public Health is influenced by the state and federal public health agencies. So just that reminder, you already know about that, but want to always talk about that guidance that we commit to following across the system to ensure safety throughout Snowline. So as Dennis, I guess these next slides, these are going to be reminders for all of you, but I just think it's important that we remind ourselves 2 general learning designs, right? The at-home and the in-person. We're going to be talking about both. Not much time on the at-home because that's up and going, the remote school as well as homeschool. So Dennis, as you go to the 5th slide, you know, there's we just had Principal Brooks here at our at our meeting, right? And we part of the at-home design is Snowline Academy. That option, we just heard about the numbers and the success that they're having. And then Dennis, as you go to the next slide, the remote school option, where kids are tied to their neighborhood school. I'll put that in quotation marks, right? Because we do have the option for intra-district open school enrollment in that regard, as long as there is space and availability in the given programs. But the connection for our kids to their teachers in that remote school learning environment, those are still up and going. And I appreciate the work that occurs across the system to make both of those happening. So then on slide 9, I think it is, Dennis, want to revisit the color-coded county tracking system because there's been a change here. I won't belabor what you already know. We know that there are 4 colors. Purple is the tier that San Bernardino County is in. It is the one that has the most widespread, and that's the terminology used, widespread impact of the virus within the county. Just some reminders that will come into play. When we talk about in-person learning in the purple tier, cohorting as well as youth sports and the elementary school waiver can occur while a county is in purple tier, but what cannot occur is in-person learning across the entire system, meaning the upper grades. In our instance, where we have middle school and high school, that cannot occur until we as a county get into the red tier. That's not a Snowline decision. That's a California state decision, as is communicated to the counties, okay? And that last bullet's an important one that we're gonna spend some time on. There are now 3 county metrics being monitored since the last time we got together 2 weeks ago. There used to be 2, there's been a 3rd one added. So as we go to the next slide, let me just talk about those 3 metrics. You know the first 2, and I won't spend too much time. Daily new cases, and no, that's daily new cases per 100,000 residents, that metric, so that we can compare communities. But there's an adjustment that now has been added to that. You might ask, well, what does the adjustment mean? If a county is not testing enough per the California Department of Public Health requirements, right? That the median, if we're not at the median or above, there's an adjustment made in the numbers. And I can share with you right now, having talked with the lead of San Bernardino County Department of Public Health in the middle of last week, that fact that we're not testing enough has impacted our numbers and has increased the case rate. That adjustment has gone up because of that fact. I will share with you that San Bernardino County Department of Public Health has a plan to increase testing, and they're hoping to make certain that adjustment will not be made upward in the future weeks, but as of late it has been occurring. But that still that measure remains, new cases. Also, the rate of positivity, right? And it says right up there, it just simply put, of the people who are tested, what percentage of people are testing positive for COVID-19. Those have existed, those 2. The 3rd one's the HPI, right? The positive rate in healthy places index, as it says there. And that lowest quartile is going to come into play in just a moment. But Dennis, I think it's probably best explained in this next slide. It's a text-heavy slide, and I apologize for that. But I don't like to do this very often, but I do think this one is very important. This came to us directly from San Bernardino County Department of Public Health personnel. And I appreciate that. You can see in the quotation marks, it's directly from them. You can see the highlights here that I'll take you through in just a moment. But what I really want to emphasize, though, that the state on October 6th implemented this California Healthy Place Index metric that we are accountable to. And that one sentence I think is really important there that's in bold, and I'll read it if you don't mind. It says, for a county to move to the next less restrictive tier, their lowest quartile HPI census tracts. Now, just real quickly, a lot of maybe technical terms there. The lowest quartile means the bottom 25%, okay, of HPI census tracts. And you say, well, what are those? Not necessarily cities, not necessarily towns, but even within our own boundaries, for instance, Phelan has been divided up into 3 different areas, and they're monitored by this HPI, this healthy place index. So as it says, the lowest quartile, if our communities are in that bottom tract, they must also meet the required test positivity thresholds for the less restrictive tier. So then, just in maybe simple terms, now that we're in purple, our communities, as well as all San Bernardino communities that have the tracts that are in the lowest 25% or 25th percentile, they have to have positivity rates that are below 8% for us to get into red, just like the regular, if you will, that existed before. That positivity rate has to go below 8%. And people might say, why was this added? The bottom line, this is to address the disproportionality of bad health outcomes to numbers of groups in California. This is why this was added by the state. So as we go to the next slide, Dennis, and again, all that's a dense slide there, but it'll be on record there so people can go back to it and look back on it as needed. So what are the components in the Healthy Places Index? You can see, I think those are 8 of them right there. And within those 8, I can tell you, I counted them up. There are actually 24 factors within the Healthy Places Index, and they're in those 8 categories. So basically, on average, there are about 3 factors within each one. And so as you go to the next slide, Dennis, and thank you for bearing with me on all this, there right in front of us is the index and how it's calculated. And I know it might be a little bit small, and so I apologize for that, but I can read across there. On the top are those 8 areas that make up the California Healthy Places Index. And then below that, you can see the percentage factor that they weigh into the HPI. And so the economic conditions of a particular community weigh heaviest. It's about 1/3 of the factor. And what are those 2? The employment rates and the general income rates go into the creation of the 1/3 weight of the economic component. The second greatest one is actually the 3rd in orange, and that's education. It has almost a 1/5 factor, meaning it's 19% of the weight of the HPI, and it measures numbers of kids in preschool, in high school, and for adults, the attainment rates of bachelors in education. So a lot of factors here. I won't read through every one. I put this up here to really give everyone the indicator of well, how is this HPI created? There it is right there. But also to give everyone the notion that there are a lot of factors that go into creating this Healthy Places Index as developed by the state of California and those who they work with. So there is the index itself that we're now held accountable to as a county to be able to get out of purple and into red, and then from red to orange and from orange to yellow. That was the factor that was added. And as Dennis goes to the next slide, I just pulled up one of our communities, and that is Pinion Hills Elementary School. On the right-hand side, you can see the community track scores for all of our communities. And I think I'm going to start there before I go with the Pinion Hills. But again, simply put, you can go on to the internet and just simply type in the California Healthy Places Index. You can look up any of the communities within our boundaries and up and down the state of California. And I took a snapshot of Pinion Hills here, but let me read through again on the right-hand side. You can see Phelan has 3 tracts. And I have to be honest, I couldn't tell you what truly defines a given tract, but they're delineated in a way that makes up the sum total of our entire district and then some. So Phelan has scores of 28.3, 31.0, and 35.6 for the 3 community tracts that the state of California is monitoring and measuring for Healthy Places Index. Pinion Hills has a score of 20.6. Now, Oak Hills and Victorville, I want to be careful with those. As you scan on there, you can see that Oak Hills is in our boundaries, as we all know, but it also extends a little bit beyond our boundaries. And it has another part of Oak Hills that goes further out. Same thing with Victorville. Those 2 scores are for the portions of Victorville in part that come our direction, but aren't completely in our direction. So it's not a pure design that the state of California has developed for our boundaries, but that, at this stage, I will just say that is the rule of the game, if you will, relative to the HPI. And you can see those scores for Oak Hills, Victorville, West Cajon Valley. Again, some of that creeps out of our district and beyond our district. And then Wrightwood is one like Pinion Hills and Phelan, that they are pure to the extent that they are within our district's boundaries. You can see those scores. Now, again, all those numbers are straight off of that website. Again, I'll urge everyone to go ahead and go in there and you can see what those scores are. I just felt the need to give these 4 slides here of the view, so the new rules.
Dr. Holman, can I ask you a question?
Absolutely.
I don't know, like at Phelan 28.3, 31.0, and 35.6. What does that mean now?
Yes, thanks for that question. So what that means is, with 100 being the top score, if you will, a perfect score on the Healthy Places Index, you can see that in this case, Pinion Hills, and why I put it in bold is because you can see their slide, right? If you were to go on the website, that's the information you would get. And what would also be part of this would be in San Bernardino County. San Bernardino County has numbers of, I don't want to say communities because it's more, it could just be tracts, right? Community tracts, portions of communities that are showing disproportionality in their health outcomes. And Pinion Hills has a score of 20.6. Why I highlighted that is because at this stage right now, as the HPI is calculated, remember Nielsen, Pinion Hills would be one of those communities that San Bernardino County will have to measure the positivity rate for COVID-19 to make certain that to get out of the purple tier, that percentage of positive COVID-19 cases, not just in Pinion Hills, but all the other communities in San Bernardino County that are scoring below 25 has to be below 8% for us to be able to be considered as a county to go from purple to red. It's that additional metric on top of those other 2 that existed. I know it could be confusing. Does that help?
Dr. Holman, I appreciate your explanation. I didn't understand any of it. I have no idea what this means. And so I appreciate all the work that you're doing. But, Wrightwood has one of 63.6. They've had very little COVID problems up there. Is 63.6 better than Phelan? What does that mean?
Sorry, Member Nielsen, to cut you off. So the higher the number would mean from the state of California's standpoint, the more healthy that community is. Not just with COVID-19, I want to be really clear, Member Nelson, not just with COVID-19, but Dennis, if you could do me the favor, could you go back as I count here, 1, 2, maybe it's just 1 slide. I'm sorry. I guess it's just 1 slide, Dennis. Yeah, sorry. In those 8 areas, Member Nielsen, those numbers that you saw beforehand would then say that Brightwood, with its score of 63, would have a healthier community based upon the economics and education and transportation and social measures in the neighborhood and the access to healthcare and its housing for people, as well as its clean environment. That it would be a healthier community. More than 63% of the communities in California, because that score was 63. What was it? 63.6.
Is there a threshold we have to achieve in this category?
So the threshold we as a county have to achieve is for our communities that are 25% and lower, okay, that lowest quartile. So the communities in all of San Bernardino County that have scores up from I'll just say 0.1 up to 25, that threshold we have to cross is less than 8% of positive COVID-19 cases.
So they're just regionally narrowing this defined area.
Yeah. So
that's targeting the COVID issue?
Yeah, I think that's well said. I think, the best way to look at it is there are now 3 metrics. For San Bernardino County to go from purple to red, we have to have a case count, right, that is less than 7 per day, right, per 100,000. That's one measure. For San Bernardino County to go from out of purple to red, it also has to have a COVID-19 positivity rate below 8% for everybody who lives in its boundaries for San Bernardino County. Then they regionalize it, like you said, and said for those regions that have an HPI score of 25% or lower, that the COVID-19 case rate has to be below, not case rate, positivity rate has to be below 8% as well. So
But
it's the additional metric.
If we get tracts that are within our boundaries, it still doesn't help us if we have really high numbers on those tracts, because it's still the aggregate.
It is still the aggregate for the county. We are part of the county, and that really hasn't changed, right? I mean, we've been going along with the county from day one, right? Our COVID-19 data have always been better than the aggregate of San Bernardino County, right?
Sure.
So I would argue that part hasn't changed. We're one of many communities within San Bernardino County. What I endeavor to do, and my apologies if I confused everyone, but endeavor to do is just to show everyone that there's a third metric, and that third metric hopefully tried to share with you how that works.
Yeah.
And that in this case, Pinyon Hills and their COVID-19 rate, because of their healthy places index score, they would be one of many other communities in San Bernardino County that are below 20, a score of 25, that would be looked at to say, how are the positivity rates going? They better be below 8% if we're going to move, is what the county would say.
I think
if not mistaken.
this provides interesting data, but I feel like those other 2 criteria that had to be met to move from purple to red was more demonstrative of what we are actively doing as a society to contain COVID. I don't see that considering the economic status and the education level of a tract is furthering our knowledge.
Yeah, and the explanation they've given us, and kind of back to that dense piece that I shared with you, is it's addressing the disproportionality, right, per the state, right? The state is saying that. And again, want to be really clear to everyone listening here. This is not our choice, and these are the rules of the game here that just make sure everyone outside hears that. But those are the 3 now that are being monitored and have to be. So.
Interesting.
So is there any advantage, Dr. Holman, for people to be tested? I know I've been tested 3 times because I take care of my mom who's over 100 years old. And we were over there last week because of my allergies. I said, well, I want to make sure that my itchy eyes is caused by the allergy. So we went and got tested. There was nobody there. They had 4 testing stations. Me and Marlena, we made an appointment. We walked in. We were the only ones there. And after they took the test and we left, there was no one there. So there's nobody going to those testing centers. It isn't like it was when the first time we went. There was people lined up outside, and you had to wait, and all kinds of stuff occurred. It's not like that right now. You just walk in, get your test done, and take out as long as you have an appointment. And so I don't know if there's advantage for people in the community to go take the test, because I think most of them are going to come back negative.
Yeah, Member Nielsen, I'll tell you, I really appreciate your, first of all, you start off with a question, is there an advantage for us to test? And the answer, the quick answer is yes. And I think you're really on to exactly what the county of San Bernardino has asked all of its residents, and that is to do just what you said. Because I think what you're getting at, that simple math problem, right, as that denominator, continues to grow, right, and then if there aren't as many numerators that grow, right, numerators meaning that number on top of that fraction being the positive cases, and the bottom being an increase in number of people who are tested. As that grows, I think what you're getting at is that would decrease. And I can share with you again, the county supervisors at one of the more recent meetings and continues to talk about just what you're saying, is to get out there and test.
Because it's easy to do. It's tougher to register and make an appointment than the actual test. It just takes a moment. It's not very invasive. You do it yourself, and you go in there, and it just takes a few moments to do it. And there was absolutely no lines doing it. So I'd like to encourage anybody out there, go get the test. It doesn't cost you anything. And then the next day they call you up and tell you you're negative, then you feel good.
So you got your results within 24 hours?
Yeah, we went yesterday, and I got them this morning at 9 o'clock.
Remember
And
her?
me and Marlena did a little dance after we were both negative.
Member Hernandez, did you have a comment?
Yeah, but basically getting back to this HPI piece. So as I understand, the HPI has nothing to do with the COVID cases, testing, or whatnot. It's just the state trying to capture perhaps more vulnerable people or areas, so that those get the I guess representation, or ensuring that they are being protected as much as other areas. Is that a fair description of what the HPI is?
Yeah, that's an absolutely a fair description as to how the HPI is being used in this COVID-19 metric. You're exactly right. I think you captured that very well. It's back to the disproportionality, those vulnerable groups. The state has said we want to ensure that not just in aggregate form, all people, but also those areas that are more likely to have negative healthy outcomes as measured by the HPI. And so they're using the HPI in the way that you just described. So I appreciate you describing it the way that you did.
Very good, thank you.
And so then Dennis, if we can go to, if you don't mind, he's doing such a good job going forward. Perfect. So there are colors right there, right? Those are the tiers. We remain in purple as a county. And I already said these, so I won't belabor it, but again, you can see more than 7, more than 8% by being in purple. You might say, where's the third column? Actually, I went on even this actually close to noon hour, and they still haven't updated this one with the third column because it is relatively new, but we'll see a third column. It'll be identical to that second column that says more than 8%. But the difference will be what Member Hernandez just said. It'll be the HPI, those areas of HPI, the lowest 25%. So that's where the county is right now. And as we go to the next slide, just want to give you some county data real quickly, and some Snowline data. I think you'll like seeing too. Those those dates really haven't changed. What has changed are those numbers. September 22nd was a unique date, and this is kind of just show you what we're up against here. By no fault really of anyone, it's just how the system is working. On September 22nd, that was the only day in San Bernardino County back then where we were in red in both of the metrics, those two metrics there. But you might say, well, Ryan, that's in purple now. And Ryan, that numbers change. Well, yes, these numbers have changed. And what's occurring is as the I'll call them the rules of the of the COVID-19, tier process that we're monitoring on a regular basis has changed, so too have the data based on those adjustments that I mentioned earlier. So those data have been updated. You can see we now haven't gotten out of purple on the case count. On the right-hand side, we've gotten into red. And as that reminder here, we have to get not just both, but now all three out of the purple. And now that this HPI is just coming into play, those dates are since October 1st. But what I can share with you is that we're in purple as a county for the HPI numbers as well. We'll add that one in the ensuing meeting so you can monitor 3 columns here. And so then Dennis, in the next one, thanks so very much here, Snowline data. And, sorry, Member Colomb, I see your microphone's open.
Yeah, the daily COVID-19 cases per 100,000, are those the adjusted numbers? So I'm guessing that those numbers are higher, adjusted numbers are higher if you don't test enough people, that those numbers may not even be real. They're adjusted upwards because you didn't test enough people. Am I right about that?
Yes, you're exactly right. There is a factor, and I couldn't even describe the factor. I'm sorry, Member Colon, but we heard directly from the director, and he didn't explain to us how that factor works exactly from a mathematical standpoint. But the way that you articulated is correct. That
So
because San Diego County has not been testing enough, they've been increasing.
Technically, you could have 0 cases and still have a high number if you're not testing enough people.
Yeah, I mean, by definition, you sure could, and so then that leads to back what Member Nielsen said is, and I can share with you, health officials are saying it, and this isn't just Ryan Holman saying it, is let's get out and test, right? It's health officials at San Bernardino County, their supervisors saying get out and test on a regular basis, posting that information on social media, and it's very public for the reasons in part, I think what you're alluding to, Member Colomb. So thanks for bringing that up. And there, that next slide that Dennis has done so well, he's got us on 17. Yeah, I think it's number 17 there, right? You can see the data for our boundaries, okay? And this is just really important, our boundaries. I don't have the HPI on this one yet. That'll eventually come as that's, part of the equation here. We don't have those data yet, but you can see that Snowline itself has gone from purple to red to orange to yellow on the case count. You might ask, what about the positivity rate? Unfortunately, we don't get those data from the county by district still yet. I think I've shared with you that we've made requests for that, but they're just not in a position to be able to provide that for not just our district, but all districts. But right now, as of today, remember Tuesday's reporting date, you can see that we're in a yellow. That is, from a case count standpoint, that's the best level that can exist in the COVID-19 setting, which is less than 1 new case per 100,000 per day at that 0.9. So wanted to share with you the latest data that we've gotten on Snowline. And then Dennis, as we move forward, that leads us to, along this agenda here, the in-person learnings that are going on and that can be going on that we want to talk to you about. And first and foremost, it's cohorts with acute needs. You might recall our last meeting, we were preparing for the opening on October 5th for a number of classes, those being specifically 7 classes in Snowline of our most, what I would say are students with the most acute needs. And they opened up at Pinyon Hills, as well as Vista Verde Elementary School, 2 there, 2 at Heritage, and 2 at Serrano High School. And I just have to say, before I forget, just so thankful to all of the staff members involved to make that happen for last week. And when I say all, there are a lot of staff members, and everything from, first of all, getting kids there on transportation to feeding kids on a regular basis, right, once they're there. And then all of the staff who make the learning happen, and the office staff. I mean, just tremendous work across the system. Couldn't be more proud of a collective here to make that happen. You see Quail Valley's up there. They're opening up on October 19th, which would be the first day we come back after fall break. So just wanted to share with you that those are the cohorts that are in play right now. And then want to also share with you that we're working on additional cohorts, and we'll have that conversation maybe at the very end here, but working on additional cohorts. Where do we go next, right? What are those next cohorts that are most in need while still following the guidance to be able to support our kids? We've been working with leadership and our stakeholders. Will continue to be connected to them on a regular basis, informing them and working with them to do what's best to serve our kids within the guidelines that we're faced with. As for school-based sports, thanks, Dennis, for going to the next slide here. We talked about what was on the verge of happening there, and you can see the requirements there. Right, with Elementary School Running Club opened up on October 5th, you might recall, and has had great success based upon the feedback from Principal John Garner and their staff members. So credit to them there. Toronto High School considering an opening up on Monday, October 19th. We're still getting some clarity from San Bernardino County Department of Public Health. We've done that a numbers of times. We appreciate that relationship we have with them. Just as a reminder, again, all sports have been pushed off basically to the second semester by CIF, but conditioning can occur, and we're making certain that we get clarity on phases 1 versus phase 2 around what can happen with cohorting as it relates to youth sports. And so know that we'll provide you with updates there on the school-based sports area. And then on the hybrid design, that's an in-person learning design, right? The hybrid design. Again, I think I've spoken to most of this, but want to make sure you see the slide there. When we talk about that, the guidelines are very strict and have to be followed to go back into that, but we can't get all of our schools back in a red until we're in red tier. We've talked about that already. All 3 metrics, we mentioned that. I want to really hone in on that 2+2, that 4-week process. So just to give all of you as our board members that reminder that for us to open the doors for all grade levels in red tier, it's not being in there one day, it's not being in there for 2 weeks. It's actually a 4-week process. It requires the data in all 3 metrics to be in the red tier for 2 straight weeks. So then that would signify, okay, San Bernardino County's now gone to red, and then it has to stay there for 2 more weeks for schools to open. That's just how those rules are made. Those aren't our rules. Those are the rules at the state level that the county has to follow. So it's really a 28-day process once all 3 metrics are in red. And if one of the 3 metrics goes to purple, that starts the count over, right? It goes back to 0. So it has to be, all 3 have to stay in red for that period of time. And so that would be where we talk about a hybrid design for our middle schools and high schools. That's contingent upon that information that I just shared there. And then Dennis, thanks for moving ourselves along here. Then on number 19, there was a public comment on this elementary school waiver. I want to remind everyone of this here. And you might wonder, okay, how does it work, right? So San Bernardino County grants, the waiver, but the California Department of Public Health does review them, as it says up there. So it's a 2-agency, meaning the local as well as the state, who reviews them and ultimately approves them. Now we can submit them while we're in the purple tier. That's totally allowable. And you saw the data. Right now it's fairly stable, right? I mean, not even stable. I mean, it's better than stable. It's actually trending downward based upon that graphic that I shared with you, our COVID-19 within our boundaries, based upon the data that the county uses. Very clearly, and it's really the work that we try to, do all the time. It's not lost on us that we have to work with our stakeholders, but that's a requirement of that process. But, that's not new for us. We're committed to that process. Our recommendation here, tonight we'd love to talk about is just explore the option with our stakeholder groups. I mean, let's talk to them now. Beforehand, the data were different. Now they've changed. And so our really recommendation is let's just start working with our stakeholders to say, now that the data are changed and are different in our own district, as against as compared to, I should say, the county, let's start having those conversations. I use that term purposely. Let's deepen the conversations. We had the talk before. We wanted to go all at the same time, but now the data are different. And so our thought would be, let's have those conversations with all those groups. We've had them with them at some level before and came up with our original proposal. Months later, weeks later now, the data have changed. So we want to get back and have those conversations and to determine, as it says there, how supportive our community is We talked about our survey. We feel like maybe right now is time for another survey, right? We mentioned that, and then make plans accordingly. So this isn't saying, and our recommendation isn't yes to the waiver. It's moving forward with that concept of, is that something viable at this level, the board level, as well as across our whole stakeholder group, is to have that conversation. So that's the elementary school waiver piece there, Dennis. And then, oh gosh, I'm sorry. That is not the best. I tell you, that's not the graphic I chose for that one. I don't know why that disconnected. I'm going to say, nothing other than that's my fault there. That was probably my best picture that I had there too, right? So my apologies there.
The information's there. That's what
Yeah,
matters.
thank you. The information is there. So my apologies for something not coming across. That's not Dennis's fault, by the way. That is mine there for some reason. But you can just see these 3 bullets, and I'll just get it right back to the end here because there's only one slide after this. And just reiterate, we want to work with our stakeholder groups. What are the additional cohorts, as well as maybe an option with the elementary school waiver, whether or not that's viable or not, start to work with them. And that would be our recommendation. Secondarily, continue to monitor data and keep all of you informed. And then, Dennis, that would get us to the last one. I hope, hey, that one did work there. And then there it is for any questions there. So back to you, President Behringer. I know that's a lot of information. I hope it's helpful, but certainly willing to have a dialogue and certainly about the next steps and any other questions that might come to pass
Well,
here.
I appreciate the presentation. I feel like that the HPI was a rabbit hole. I don't know that it's helping us to make an informed decision, but it's interesting information that they're analyzing. Are there comments or questions from the board?
Madam President, this is Dave Nielsen. First of all, thank you, Dr. Holman. Whatever we pay you, it's not near enough. Only in California. I don't know how they could make it any more complicated than what they're making it. And clarify me or correct me if I'm not correct. It's my understanding from the data you presented, the one data we get from the county that represents our students in our school district, we're at yellow, which is the highest you can be. We have to wait until the entire county of San Bernardino gets to a level before we can even consider what we're doing within our school district. Am I getting it right?
Yeah, remember, Nielsen, that's correct. When we talk about all kids, right, that would mean, TK through 12th grade. Preschool has just a slightly different design they operate from, but it would be preschool through 12th grade. You described
this makes me extremely uncomfortable. Last week, I got a mowing machine from back east, and they shipped it to a trucking terminal in Fontana. This place was huge, so I had to go pick it up at the trucking terminal. There was hundreds of people in there loading, unloading trucks. None of them had masks. I was scared to death to go get my mowing machine, and I waited outside the office before they came out. And that's another reason I went and got the COVID test after going to that place. And I asked the guy that brought my mowing machine out, I said, "Have you have any COVID problems here?" He says, "Yeah, all the time." I said, "Why aren't they wearing masks?" "Well, it's too inconvenient." Unbelievable. And we got to wait for that mentality before we can open up our schools. It's crazy.
Yeah.
So anyway, thank you for your presentation. Thank you for all your work. You have to deal within the confines of the rules. I understand that. It's not your fault. But they're putting us in a pretty bad spot, especially at the local level. And there's not a darn thing I can do about it. So thank you for your presentation. I greatly appreciate it.
Member Hernandez?
All right, thank you. I guess just to capitalize on Member Nielsen's comments, and I think that's exactly why it is important that we are looking county-wide. We are not an isolated little bubble of a community where we don't go outside to shop, to go pick up mowing equipment, to do everything that we're going to do. we are exposed, and we need to keep encouraging everyone to follow the health recommendations, keep your distance, wear your masks, do everything you can. Very encouraged by the district numbers that we are in yellow within our boundaries is absolutely fantastic. Very happy that we have been making that progress, but I just absolutely want to keep reminding everybody, follow the rules, keep your neighbors safe, and keep your family safe, wear your mask, do everything you need to do. I guess that's it for the presentation.
Member Cologne, do you have any comments?
No, it was a good, informative presentation. Thank you. Quite frustrating, but what can you do?
Well, I thank you for all the information and the effort that went into presenting that for us. I'm wondering if we will be surveying our public to see how they feel about things at this time.
Yeah, I mean, I appreciate you bringing that up, President Behringer. And really what I endeavor to, say there and hopefully try to clarify right now is work with our stakeholders. What are those next steps, right? We really see, our options now, right? As I mentioned there, our cohorts, how do we move forward with safety in mind, first and foremost, and then the well-being of all the stakeholders involved, not only from a physical safety standpoint, mental health standpoint, but also educationally on the cohort side, as well as just explore the elementary school waiver. Beforehand, we thought that the way everything was trending, and it was really clear. I mean, it's not hard to look at the data, that we thought that we'd get San Bernardino County out of there, and it's going the opposite direction. So I feel like we owe it to all of our stakeholders, like you're just asking there, to say, well, where are we now? And, credit to all the senior cabinet I work with, all of our site leaders. We're, I think, committed to finding out. I want to make it really clear. We're not saying we're going to do it. Even if a waiver gets approved, for instance, we can use that as we see fit, but we just feel like we want to find out, as you said, through surveys and through working with our various groups of classified and certificated staff members, where do we go next? We feel like we owe that to the community. So that would be our recommendation.
Okay. I'm in favor of surveying. So I know that a lot of companies, industries are opening back up and calling their employees that have been working from home, and they're going back to in-person work. So I think it would be interesting to get that information from our community. Is there any direction that you need from the
It's just it sounds like you're giving us that support. I mean, that would just be the support that those next step slide that we had up on the screen there, that that where we're headed, and if there are any problems with that, you'd let us know and say, no, don't do that, Ryan. But hopefully I just articulated that we want to reach out and find out what does the community feel like, so that we can determine what's next, what are those next best steps based upon all the data. And I want to say, it was mentioned earlier, I give the Snowline community a lot of credit, the entire learning community. Those data aren't in yellow if there isn't a commitment to working together to resolve a challenging situation. So thanks to everyone for doing that. Absolutely appreciate that. And I thank all the staff members. This is just so hard right now. And so let's find out what the stakeholders feel like. And we're ready to work to move forward on finding that out and making those recommendations.
Okay.
I don't believe that. Yeah, I don't believe, well, one, that we have consensus on that, but an additional survey, I don't think would serve us well, in that the previous surveys have been trending higher in terms of those that are willing and wanting to return to in-person learning. Obviously, this is for an elementary school waiver only, and so I think we'd be best served in putting our efforts towards looking at staffing requirements and those that would be willing, able to fill those positions, and start planning on classroom sizes and everything to that effect. I don't think an additional survey would serve us well.
I agree with that. The survey, we're dependent on the county anyway, Doesn't matter if everybody's 100% wanting to come back to school. It's not going to happen until the county says, gives the approval.
Yeah, I appreciate both of you what you're bringing up. I think what I would envision in a survey is we needed to find out here at this stage how many people now, right, 3 and 4 weeks later, are willing to come back, say, in an elementary school design, right? I mean, just flat out willing to come back, because your point's well taken there, Member Hernandez. That leads to staffing. That leads to all the machinations, if you will, that have to occur to be able to determine what's best, in terms of moving forward. So, I agree with everything you said. The only piece I would add to what Member Colom and yourself said on the survey is we didn't survey, and I don't think it's about do we pursue a waiver per se. I don't think that's the question. I think the question is how many of our elementary school families are willing to come back in this environment, right? And then based on that environment, that gets at just what you said, I think, Member Hernandez, what sort of staffing's needed, transportation's needed. I mean, all those things. And since that wasn't part of we can disaggregate the data to make that assumption. I think maybe more of those direct questions help us determine whether it be sooner or later, when we come back, how we come back. How do we come back? Do we come back in a layered approach, the lowest grade levels and then the highest grade levels of elementary school? I mean, there's so many different, potential designs. I think it's gathering information across our system to be able to make that informed decision whenever that needs to be had based upon what's best for the community. So that would just be the only piece I would add on the long-winded way of saying the survey. I think that would be the piece that we would need to hear, because we've seen over time from June to now that as the conditions change, there's a difference in willingness to come back to in-person learning, which feeds into, like you said, personnel and all those things.
So the survey essentially would be focused on those grades that would be impacted by the waiver, as opposed to all grade across the board. I mean, is that what you're looking for? Is that what you're needing to analyze this further?
Yeah, sorry about that. Remember, I was a little slow on that there. Yes, absolutely. I think it's just, again, it's drilling down, and we had that widespread survey. Now in this environment, when we talk what's available to us, cohorting as well as the elementary school waiver, given the trending of the data. And so how long that lasts, the data, I mean, who knows how long, but I think for us to be prepared relative to where our learning community is, getting feedback across our system and making the decision based upon that targeted design that you articulated, I think makes a lot of sense.
And this impacts only grades 3 through 5. Is that accurate?
No, it would be our elementary schools. Our elementary schools up to 5th grade.
Okay, I believe I remember from the beginning of the restrictions that K through 2 were under different guidelines or guidance.
What might be coming up in that regard is there's some, it's so challenging, right? All the guidelines are just incredible. The face masks and face coverings design was connected to, I wonder if this is what we're talking about here, was connected to preschool up through 2nd grade. And in fact, just on Friday, Robert Chacon, James Fields, and I had a conversation with one of the Department of Public Health officials, and very clear that even though the writings from the California Department of Public Health, as well as San Bernardino County, who supports who in effect says yes to the guidelines that come forward to them from the state, even though those guidelines were fairly confusing, our local health officials have made it very clear that face coverings have to be worn by all elementary school kids. Face shields are okay, but and that is fine. But even though there's some conversation, at the higher federal and state level of recommendations, there's, I guess, some controversy in that regard, and they've made it very clear to us that the recommendation is it's a requirement. Okay. I wonder if that's, what you're talking about there.
I think, yeah, I do believe perhaps that was, because I remember there was a delineation within the elementary schools that at grade 2, there was a break in procedure, and it may certainly have well been the mask mandate. So very good. Thank you for the clarification.
Dr. Ullman, this is a question I have. The state is apparently changing their idea of when we can go back to school. They're changing the formula. We don't know if they're going to change any more in the future. Who knows? The question I have is, I heard in the past that we could only have like 10 kids on a bus. That was going to be it. Well, if we start talking about transportation and we're going to bus the way that we did last year, we don't have enough buses or enough bus drivers to do that. How's this all going to work? In the classroom, I've heard talk that the kids have to wear a mask, we have to have shields, all that. But yet when they go inside and outside the classroom, how are we going to do that? How are we going to do when they walk down the hallways of our school or on the porches of our school as they go to class as kids, because kids are kids. They're going to do what kids do. How are we going to monitor all that? And, I think we need to, if we're going to do a thing, we need to find out what the parents' acceptability is, because like transportation, I don't know how we're going to do it. I think we're going to have to ask the parents, if you want to come back to school, you're going to have to provide transportation. And for those really far outlying areas, we're going to use the existing buses that we have to provide the 10 kids per bus. How's it all going to work? And I think tough choices need to be made by the school district before we start polling. And I think we need to wait a little bit of time to find out exactly what the state is going to do, because I've heard tonight they changed the rules. I've heard tonight they're not clear on what's going to be required of kids when they come back into the classroom. And I don't think any of this has been explained to parents. They haven't explained how all this is going to work. There's just so many questions out there. I don't know what use the polling is going to do now until we can answer a few of those questions. I think we need to ask parents, if we don't have enough buses to transport, are you willing to transport your kid? Are you going to be fine with kids being kids when they go to school and have lunch together? Because we can't socially keep them all apart. That's not going to happen. What are we going to do between passing periods or at recess time? What are we going to do with our hands-on learner, our CTE classes? What are we going to do with how we teach school? There's just a lot of questions out there. I don't know how you're going to do a poll. If you want to find out, I think it's a good idea. You need to know, do you think you're going to be here next fall? I think you need to figure that out somehow. But I'll tell you, from just Dave Nilsson's perspective, this is a mess. And they put the local boards in a hard situation here. And so I just don't know. But I will say this, whatever you think we ought to do, Dr. Holman, I'm going to support your decision, because you've taken on quite a challenge here.
Yeah, well, Member Nielsen, first of all, I appreciate everything that you've said there. And maybe I'll start with transportation. I think, you're right. The way the guidelines are, there's, if in fact we were to start school today, for all grades, we wouldn't be able to do it, and nor would any district, right, be able to do it because of what you just said. So you're right. Some decisions need to be made. We need to survey like we did the first time. I think it was 22% of our population said they needed transportation when we asked all of them. So then, does it change with elementary school? We need to find out that information. I think you're right, and because there might be instances where we just cannot provide transportation. What I do know is we've got an outstanding leader there who has outstanding staff members who will do everything that they can in transportation to make whatever they can work. But I think we just have to find out that information, explore that. And then when you talked about the rules too, in terms of wearing during passing periods and so forth, I so appreciate that, Member Nielsen, because that is a concern too. I've been doing a lot of talking. Dennis and/or Robert, would either one of you talk about what we've observed of schools that elementary schools that have opened up under the waiver, and what you saw in terms of the rules and the teaching that went on to develop new social norms, if you will, for these kids?
What we observed was quite a pleasant surprise to us, and that an elementary school with 500 plus students was operating in a 2-day-a-week hybrid group where the kids were in school 2 days a week, the other group was in school 2 days a week, and then there was a day without kids on campus. And students were following the directions in terms of hallways, in terms of recess, in terms of getting on and off of buses, in terms of meals. Very, very orderly, to a point that it greatly surprised Mr. Miller and Mr. Chacon and myself in observing. And the staff in the classrooms, both classified and certificated, doing an amazing job of serving those students. And we were surprised how well it's been going on. At the time we visited, they had yet to have any student or any staff member in their kind of COVID symptom isolation area that had to be set up just in case somebody came to school and was ill. So again, seemed to be going very, very well with the protocols that were laid out and put into place.
Yeah, thanks so much, Dennis. Yeah, member Hernandez. Yeah, I saw you had a.
Would you mind sharing where you made these observations? Were they local, or do we have any data on high desert elementary schools that have applied and are observing the waiver, other than the, I know Lucerne Valley had, I think, one school open like that. Can you share that information with us?
Sure. It was Lucerne Valley Elementary School, which has over 500 students in an elementary waiver situation, following all of those same criteria that were necessary to be followed. We do know that Hesperia and Apple Valley have applied for elementary waivers, and we will observe there as well, if and when they have theirs approved and open up classrooms.
Yeah.
Because yes, we believe observing local is important.
Of course, thank you for that.
Yeah, and Robert, anything you want to share about transportation and/or what Dennis just said so very well?
Yeah, nothing real. I think Dennis did a really good job kind of summarizing our visit. But I will say, Dave, I have, I still have, but I had a lot of those same questions that you brought up, right? I kind of take the realist approach into all of this, right? I have 2 elementary kid students, so I'm always kind of looking through the lens of, the dad of a, 5th and 3rd grader. But I will tell you, Dave, and board, I walked away from Lucerne Valley with hope, to be quite honest. I had kind of the same outlook, Dave, like, man, how is this going to work? How are kids going to follow the rules? How are we going to get them to, follow those new social norms? But man, I walked out of Lucerne Valley with some hope. Those kids were awesome. They kept their face coverings on. They followed directions. We watched their breakfast, their nutrition program in the morning, and the kids followed directions there. It was very, very well thought out, and the kids were really, really happy to be at school. And they did a really good job, being compliant with all of those guidelines that are set forth by the county and the state. Transportation along the same lines, Dave, you're totally right. We were kind of joking a couple of weeks ago, hey, if we have to follow these guidelines and we're bringing back 100% of the school, we're going to have to purchase, like 86 more buses or something to make that work. It's just not feasible. So Lucerne kind of has a little hybrid program going, since they are doing cohorts, right? Or they are doing an A and B schedule. So kids come 2 days, they're hybrid on Wednesday, come back on Thursday, Friday, another group of students. So transportation is automatically cut in half. And then what they realized was parents were more apt to drive their kids to school as opposed to putting them on a bus. So that kind of helped out with their numbers as well. So their transportation was very small. It was like 7 kids on a bus route. Some of them were transporting one student on a bus route. So they were able to make it work. But, we are talking about just one elementary school. I realize that, not 5, right? So we definitely get that. But I will tell you, I left Lucerne Valley with a little bit of hope.
I'm glad to hear that, and I appreciate your comments. My major concern is at the high school. I don't know how we do the CTE programs. 80% of our kids aren't going to go on to college. And what are we doing with their pathways? I know they're trying to work through that right now. But we got to get those kids back. I know there's school districts in the state that are bringing back the CTE classes in a block period. So it acts kind of like the A-B type of schedule. And they've got them back in much smaller class sizes. And that seems to be working at the high school level and the middle school level. And I'm really concerned about this whole thing. I know last spring it happened. I don't think it was a great experience for students and for learning. I think this year is going better. I think are trying. But it's just like the comments at the beginning of our meeting. I hear so many comments, my kids can't take too much more of this. What's going to happen? And, I wish I had some.
I think we lost Mr. Nielsen by accident. He'll probably pop back in there. I know I've done that all too many times, press the wrong button there. So President Behringer, I'll put it back over to you, knowing that, again, we just appreciate all this feedback.
Member Hernandez?
Just to clarify, I know Member Nielsen speaks of the high school program, CP. They're only speaking of elementary school waivers at the time. There is no opportunity to open up anything else.
Yeah, thanks for asking, or for mentioning that, I should say, Member Hernandez. So the elementary school waiver, you articulated that correctly. What I think Member Nielsen was alluding to, and it's an accurate conversation, and that is the cohorting piece. And so we've been working really close with San Bernardino County. I will tell you, I just appreciate the what I feel like the direction you've given us from day one, and that is to follow the guidance, right? And so we've been really trying to get clarity on the guidance. I can tell you that in the cohorting guidance, the spirit of that, and having talked to, again, the public health official on Friday, it's about kids with acute needs. And so we started with the kids with the most acute needs. And that would be middle school, high school, in addition to the elementary school, special education, moderate to severely challenged kids. And so, to that end, I can't speak for every other district, but us talking directly with the county health official on Friday, that's the spirit of that. And we feel like that's the right way to continue to follow and to continue to scale up cohorting in that regard, meaning how do we meet the kids with the most acute needs and do it in a safe fashion.
Thank you.
I hope I'm back. We had a momentary power outage at the house. It went off for a minute and I had to rejoin. So anyway, I'm back.
You did well there, Member Nielsen. I just want to make sure give you that chance because I want to make certain you heard everything that Robert Chacon shared with you about transportation and the rules. Did you hear everything from him?
Yes, I did. And thank you, Robert. This isn't easy for you either. I understand that.
I share in your concerns about the CTE programs because they are so hands-on, but we are not looking at any time in the near future returning to in-person at this secondary level. It's my understanding.
Just looking at the data right now, and again, that's a crystal ball question, right? I mean, I guess I would say this, while the rules have changed in many cases to make it more challenging, they could very well change the opposite direction. And so I guess I always want to put that caveat out there. It's almost, you're right. We try to predict based on the data trends, but also be ready on a day-to-day basis. It's an interesting environment for sure that way.
Very dynamic. Are there any other questions or comments? Okay. Well, thank you very much for that presentation.
Well, thanks, President Barrington. I just wonder if this would help everyone because I did so much talking. My apologies for that. But boy, there's a lot of information out there. So our next steps would be, again, just really our commitment to continue to work with our stakeholders to find out what are the best ways to meet the needs of our students, and considerations like elementary school waivers and cohorting and anything else that would come our way. And we continue to keep all of you, apprised of that. Does that make sense?
Yes, it does. I believe that we need to be prepared for whatever the future brings. So, and we're all excited about returning to in-person at the earliest possible point when it's safe to do so.
When it's safe, yeah, well said.
Absolutely. Okay. Thank you very much. That then takes us to board member comments. And I would just like to share that back in January, our teaching staff participated in Kagan Structures training, extensive training. And then last week, Kagan offered a 2-hour in-service to show the adaptability of their structures for remote learning. And I participated, and it was a lot of fun. And in speaking with Vern, the gentleman leading the training, indicated that nearly every one of their 250 Kagan structures are adaptable to remote learning. And I really appreciated their focus on the social emotional aspect of learning. And they have a very great concern for students and just really look to connect the teachers with the students. And I appreciated that emphasis. Those are all the comments that I have. Member Hernandez, your comments?
Thanks, Madam President. Only want to mention that over this period of different times, my wife and I were able to donate blood a couple times now, and it's been pressed upon us how little blood they are receiving right now. So if you are of that giving nature, the live stream and various sources are providing a very safe, comfortable, and testing environment. If you'd like to donate, we get reports back that the testing for the COVID antibodies, to which we're testing negative, of course, but they are in high need because of this time, how much their blood supplies have been depleted because the donations are just not coming in. So if that is your type of giving nature, just want to remind you that it's a good time to do it. That's all.
Great, thank you. Member Nilsson?
First of all, I want to thank the staff. I know I sounded very negative, but I'm not. I appreciate all the work that you guys are doing. This is unprecedented time. The thing that really concerns me, the World Health Organization came out yesterday, and they said closing things down, they're causing more problems than what it's helping. And I don't know what the rationale was for that, for the World Health Organization coming out with that information. But, somebody needs to give this a look. It appears to me that we're going to be dealing with this for quite a while as far as opening up schools. And all I can do is just pray for the parents and the kids and for our employees who all want to get back to the job of doing what they do best, and that's educate kids. So anyway, that's all I have to say, and thank you to the staff again.
Thank you, Member Nelson. Member Colomb, your comments?
I would like to give a shout out to our teachers. Teaching remote learning is very difficult, and most teachers have no training or anything else on how to do it and do it right. And I know there's a lot of teachers out there who are working a lot harder now than they were in class learning, and your work is very appreciated. And then secondly, I noticed the football field is looking really, really good. So that's one positive. Grass, that is.
Thank you, Member Colomb. And I'll just comment on the absence of Member Funk is out of town, so he is not here to join us, and I miss his comments with his quotes. But we'll look forward to that next time. That takes us then to administrative comments. Mr. Miller also is absent, so we will go on to Mr. Zimmerman.
Thank you, President Behringer. Just a couple real quick. Just really a big thank you to all of the classified, certificated, and leadership staff that were involved in the successful opening of 7 moderate to severe elementary special ed cohort classes last week. I mean, it was a huge undertaking to make sure that that was safe and was able to be done at Pinyon Hills Elementary School, Vista Verde Elementary School, Heritage, and Serrano, and done very, very well, very successfully, very safely. And just reiterating that those were moderate, severe special ed classes. We started at the classes that had the most need, and seemed to be done very, very well. So thank you, thank you, thank you. It took a lot of people to get that done. Thank you, parents, for your trust and your desire to engage in that with us and bringing your students. And then, Mr. Hernandez, your comments about blood donations, I am right there with you. I've given, I think, 3 or 4 times during this, 7-month period. It's been 3. I've got 1 more coming up. And there's a huge need out there, and it's just an honor to sit there and be able to give, because I know I have family members that have drawn from that, various times throughout the country, and it's a huge need. So thank you.
Thank you very much. Mr. Chacon, your comments.
Yeah, good evening. Thank you, board, for kind of bearing with us today as we gave our first shot at virtual, in-person, live stream board meeting. So James and Rick doing great work in the background for us. A couple little glitches on the live stream feed with some presentation stuff we're trying to work out, and there's a little humming noise in the sound that we're going to try to work on as well. But all in all, just thank you guys for being patient with us and participating today in this fashion. So we're excited to be able to offer the live stream up to our community and encourage people to log in and view and get the latest and greatest. I think Dr. Holman does a great job in providing us with those latest statistics and kind of giving us a good snapshot on where we're at and how this process works for us to get back to any type of in-person learning. So just a big thank you to them, and a big shout out to the AV team, audiovisual team, running things in the background. So thanks, guys. We had 15 viewers today. It was I think that was our highlight. It is fall break, so congratulations for all of us parents getting to fall break, and staff for leading our kids up into this fall break as well. So just a great job. One of those little milestones. I know Ryan always talks about, it's a marathon, not a sprint. I always argue with him that it's more like the Tour de France, right? So there's some hill climbs, there's some sprints in there. It's a really long process, right? So I feel like we got the first sprint down from the tour, and we're heading into the holiday season. So just please be safe and careful this fall break. So thanks.
Mr. Chacon, is this being translated in Spanish?
It is. So I'm running the translation right now. We have yet to figure out how we can do English translations and Spanish translations live. So what we are doing is I'm recording this in Spanish with Spanish subtitles right now, and then we'll post it as soon as the meeting's over. It'll get posted to our website, and it'll be available with Spanish translations. So we're looking into, how we can figure out how we can do, an English subtitle and then a Spanish subtitle under it, or vice versa. We just haven't been able to find a software or program that would really allow us to do that and for it to be, remotely accurate. So that's kind of our fix right now, is we are offering Spanish translations. They'll be posted, just shortly after the board meeting.
Oh, that is great. Thank you. And Ms. Stapp, your comments.
Thank you, President Behringer. I just have one comment, and that is that last Friday, I had the sheer pleasure of hosting 4 teenage grandchildren and 1 5th grade grandchild to do at-home learning at Grammy's house. And oh my goodness, luckily I have great internet, but wow, it was quite the day. And honestly, it did not end until 4:30 after all exams were submitted and homework was completed. So my hat goes off to the students because it's not an easy situation for them. They miss their friends and that connection with their teachers. And my hat goes off to the teachers as well. So thank you.
Thank you, Ms. Staff. And Dr. Holman, your comments?
Thank you, President Behringer. A few words of thanks. I want to begin where Robert Chacon, I guess I don't want to say started, but he did mention, right? James Fields, Rick Hernandez, but also Robert Chacon. Thanks for making today happen. So easy for me in my role to just say, hey, we're going to go back, cohorting's opening up, so we're going to cohort ourselves in here, right? Easy for me to say that. It getting done is so much more difficult. So I so appreciate the three of them and really everyone involved, because if you're not getting the picture here, we've got barriers up here. We're more than 6 feet apart. We're in our own cohort here, just like our staff members who are working with our kids and all the other staff. Dennis said it very well. I think I alluded to it earlier. I just want to reinforce it. Just so impressed with all the people who made cohorting happen. It's been said many times, these are unprecedented, uncertain, ever-changing days and weeks and months, and just so appreciative of what everyone has done to get us to this point. I had the good fortune of seeing from a long distance, 20, 30 feet, some of the students, and literally talking across those 20, 30 feet saying, how did your day go? What did you think? And it was just so powerful to get that booster shot in the arm of those kids saying, I had a great day. It was great to be at school. And so we know that safety's first, and we've got a long way to go, and we talked all about that. But just want to, again, bring, as Robert Chacon said earlier, some hope to the community that there's some great things happening, not just as Member Colomb said in that setting, that is the at-home design, but also in these small in-person cohorts. So just so appreciative of everyone who makes that happen. And board members, thank you for making today's board meeting happen. You just are really modeling what we're expecting here, right? We've got our cohorts, we've got those options to say where we need to protect safety as need be. And I think this went very, very well for our first go round. So just greatly appreciate that. Before I forget, and when I went to youth sports, I forgot to say that I think Serrano High School right now, athletics, they're planning on, I didn't finish that, they're planning on starting next week. So just want to let you know that that's their plan at the moment. But again, I think I did mention that we're still having conversations with the county to determine what level of cohorting can occur there. So just want everyone to know that piece. Also want to share with everybody, it was said in the community comment, the notion of the survey and the parent letters that I typically write. I got to go on record. I forgot to do mine today. I'm going to have to do mine tomorrow. That's the first time I think I've forgotten. I apologize. I remembered it last night, but not today. So in any case, those are out in those parent letters. Please respond to the survey, just as was said. And I would just say it's just so very important, because we think of parks, we think of our kids, we think of what our kids need. Let's get what we need for our parks. And so I really encourage everyone to respond to that survey. And that reminds me of the notion of voting. Every year, not just this year, but every year, we should be out and voting because it is one of the beauties of a democracy, right? We have the capacity to vote. I'm not talking about who and how to vote. I'm talking that we just should vote. And to that end, we have 3 of our schools, Baldy Mesa Elementary School, not Phelan, but Pinion Hills Elementary School is the second one, and then Vista Verde Elementary School. Those 3 sites will serve as voting places for our community to make sure that we have localities where that can occur. It starts earlier this year, and it goes for 4 days: Saturday, Sunday, Monday, and then Election Day, Tuesday, at all 3 of those sites, for 4 of those days. So just want to urge everyone to get out and vote and use our community if you so choose to do that. Our learning communities at our schools. Member Nielsen, thanks for bringing up the World Health Organization. I wonder if maybe that statement was made because Saturday was World Mental Health Day, as sponsored by the World Health Organization. And so your point's a very good one. Everyone, I think, by now has maybe at least heard of Care Solace. Care Solace is a mental health care resource that's available on our website as need be. But I just, if you read the parent letters and staff letters that I send, I think I wrote on Friday about mental health is really overall health, right? That good health is included, or it does include, I should say, mental health. And so thanks for bringing up that point so that I could remind everyone, Member Nielsen, that the good work that's being done from a social emotional side that you mentioned, President Behringer. I'm so thankful for our teachers and other staff members who are doing that on a regular basis. Let's not forget the importance of that, and just hopefully everyone feels appreciated for that. And then lastly, it is fall break, and it was mentioned by Robert Chacon, and I just hope everyone's having everyone out there who are part of that break time are just having a great break, a safe break, and that they're recharging themselves for learning in this environment. Because what I know, I think above all else that I'd like to just end with is you who make up the 1,000 strong Snowline employees. You matter because you make kids and this learning community feel like they matter. And so everybody at this stage, all the entire learning community deserves a break so that we can recharge and get back and do the good work. So thanks, President Behringer. I appreciate the opportunity to share in this environment.
Thank you very much. And that then takes us to adjournment. I will entertain a motion.
I move that we adjourn.
And a second?
I'll second.
Very good. Thank you very much. And roll call vote. Member Hernandez?
Aye.
Member Nielsen?
Aye.
Member Cologne?
Aye.
And I for Christina Behringer. We are adjourned. Thank you so much, everybody.
Good night.
Good night, everybody.